everyone going on Medicare must be sure of three things. Number one, that they're going on Medicare at the right time. Number two, that they're choosing the right coverage. And number three, they're getting the very best cost. And in this video, I'm going to show you 6 very simple tips that will help you find your perfect Medicare plan. So to begin with, I want to address what I'm calling key factors that you must consider in this decision of going on Medicare. Number one, you want to make sure that your timing is right. Folks, not everyone has to go on Medicare at 65. Now, many do, but some don't. Now, those that do, and if you're in this group of people, keep in mind, if you're covered by a retiree plan, if you're on an ACA plan, you're on COBRA insurance, you're TRICARE for life, or you work for an employer that has 19 employees or less, you must go on Medicare at 65. You have no other options but to do that, okay? So there are those that have to start at 65, but some don't, and that would be this group of people. Anyone that is still working or your spouse is still working and there's 20 employees on the payroll or more, you don't have to do anything at all with Medicare. You don't have to enroll in A, you don't have to enroll in B, nothing at all with Medicare. Now, if you decide to enroll in Medicare A only, just know that you can no longer contribute to your HSA. So once you take any form of Medicare, no new money can go into an HSA. So those of you that have large employer plans, that have a high deductible health plan, if you have a health savings account, if you enroll in A only, you have to stop the contributions. And so I think it's much better to do nothing with Medicare and keep contributing to your HSA. Now, if you don't have an HSA, a health savings account, then it's fine to enroll in a Medicare A only, but I certainly would not take B if you have a group plan at work that is better option than what Medicare is going to make available to you, all right? So again, we have people who must start Medicare at 65 and those that don't have to. Now keep this in mind, this is important. Anyone that's going to start Medicare at 65 has what we call the initial enrollment period. This enrollment period lasts for 7 months. So let's say your birthday is July 4th, 1958. You're eligible for Medicare this year. July 1, 2023, the 7 months would be the month you turned 65, 3 months before, and then 3 months after. So if I'm coming in during my initial enrollment period, I have 7 months to do it. So in other words, if you're in that group of 5 people that must go on Medicare, you have 7 months to do it. Now, if you're already on Social Security, Medicare will automatically enroll you. Social Security will enroll you into Medicare automatically during the initial enrollment period. And you're actually going to get your Medicare card. Let's go back here. 5-4, you're going to get your Medicare card during the month of March. It comes about 100 days before your birth month. But if I have to self-enroll and I do it 3 months before, I start my Medicare in July. But what happens if I wait for whatever reason and I enroll in July, they start me August, I enroll in August, they start me September, they'll start me October, the very last month I can enroll, I then would start then in November. Okay, my whole point is we have 7 months to enroll, and those of you that must, you're going to have to do it during this period of time. Now, those of you that are still covered by a group plan, remember you or your spouses, 20 or more employees that are on the payroll, you don't have to do anything with Medicare. If you decide to take A only, that's fine unless you have an HSA. So you are going to come into Medicare not during your initial enrollment period, but rather during what is called a special enrollment period. And this is for anyone that didn't start Medicare at 65 because they were covered by a group plan. They're their spouses. Now, the key to this is this. Let's say your birthday is July 4th, 1958. You're eligible for Medicare in July. So what we have to do to be eligible for a special enrollment period is we have to prove that you've had credible coverage at work, you or your spouse's work, so there was employment and there was insurance all the way back to July. So if I'm going to start Medicare, let's say 2 years later at 7/1/2025, I got to go 2 years back and prove during this period of time that I've had active employment and insurance at work with no gaps whatsoever, and COBRA is not considered credible coverage. So you just got to make sure you have coverage. Now, what we're doing with this SEP period is 2 things. We have to fill out what's called an L564, and we had a form called a 40B. Now, the L564 is what your employer fills out proving you've had credible coverage. If you've changed jobs after 65, you'll have to have 2 of those. The 40B lets Medicare know when you want to start your coverage. So if my coverage is going to end, let's say June 30th of 2024, on my 40B form, I would say, please begin my Medicare July 2025. All right? And so that's how we come into Medicare. If we don't have to start at 65, we're going to use the special enrollment period. So again, the key is to make sure you come into Medicare at the right time. Hey, just real quickly, if you're finding this video to be helpful, you can like, comment, and subscribe. And if you do so, that'll let YouTube know that this is helpful information, and they'll send it out to others who also need to learn about Medicare. Now, once we've made the decision to start Medicare, you have to realize, folks, there's really only going to be two good Medicare options to choose from once we're enrolled in A and B. So some people will do what is called A and B, and they will get a supplemental plan. A supplemental plan is a private health insurance company that is going to fill in the gaps that Medicare did not cover. Now, I'm not going to go into all the details of all the gaps. I've got plenty of YouTube videos about this, but what is important to note is on the A of Medicare, we have 3 gaps. Those are deductible, and those are co-insurance for extended hospital stays and skilled nursing stays. On the B side of Medicare, we also have 3 gaps. And that would be a small deductible, and then co-insurance, and then excess charges. So the point is, original Medicare doesn't cover anything 100% other than preventive services. So you're always going to have some balance remaining from a hospitalization, from a doctor visit, from an outpatient surgery, from an MRI. There's always going to be something you're going to be liable for. So those are called gaps, financial liabilities that you are going to be responsible for. 3 on the A side, the inpatient side, 3 on the B side of Medicare, which is the outpatient side, and all doctor services. That's what a Medigap policy does. And so most people today are getting a G plan, which covers 5 of the 6 gaps. The only gap it doesn't cover is the Medicare B deductible. This year, that's $226, and that's once a year. So if someone has a G plan, it's almost full coverage. Not quite, almost, because you would be responsible for the B deductible once a year. It resets every January. The plan below that is called an N plan. It covers 4 of the 6 gaps. It will not cover the B deductible, nor will it cover excess charges. So if you go to a doctor that adds to the bill, and they can do that, then you would always be responsible for that if you had the N plan. Plus the N plan, every time you see a doctor, you're subject to a copay of $20. Go to the emergency room, subject to a $50 copay. So your premiums are going to be lower on the N than the G, but you're going to take on a little bit more liability. You just got to decide what's best for you. My whole point is this: when we go on Medicare, we have these options. So we can stay in original Medicare A and B, get a supplemental plan, and then with that, what's going to happen is we add a separate drug plan. Keep this in mind. It's a drug plan that you picked out based upon your meds and the pharmacy you want to go to, and you can change those on an annual basis if you choose to. Supplemental plans are typically written for life. Most people don't change those, but you could, and those rules vary state to state. But here's my point. This is one option you have. Stay in A and B. Medicare pays first. Balance goes to supplemental plan based upon whatever one you buy, and it's going to cover the gaps that you purchased that supplemental plan to do. All right. The other option you have is to do what's called a C plan, and these are also called Medicare Advantage plans. Now, here's the way Advantage plans work, because it's a different system than this over here. The only thing, frankly, that these 2 systems have in common is you have to be enrolled in Medicare A and B, which means what? Got to pay my Medicare B premium. Most people, it's $164.90 a month. Comes out of your Social Security check, or they'll bill you on a quarterly basis, or you can set up a bank draft until you start taking Social Security. If I have a C plan, same thing. Got to be enrolled in A and B. Got to pay my B premium, $164.90 a month. Again, comes out of your Social Security check. But now what I have is a replacement plan. So all the A and B benefits are no longer covered by Medicare. Now the Advantage plan is going to cover those benefits. Now, one thing that's going to happen here, if I have a supplemental plan, I got to pay a premium for that G plan or for that N plan. Got to pay a premium. Most of these are about $90 to $100 a month. This is going to be around $125 a month. Again, that's going to vary throughout the country, but that's kind of a ballpark. Okay, now C plans almost always have a 0 premium beyond, of course, what you're going to have to pay Medicare. Why is that? Well, because in this system, what happens, you don't have a bunch of gaps. Instead, what you're going to be paying for would be copays, sometimes co-insurance, and sometimes also some deductibles. So either way, we're paying. Here, we're paying a premium and pretty well get rid of all the liability. Here, we don't pay a premium, and we're just going to assume the liability of all the healthcare services that I'm going to need. A couple examples. Most primary care doctors, 0 copay. Specialists, about $25 to $50 copay. Go to the hospital. It's going to cost you anywhere between $300 to $400 a day, up to maybe 5 or 6 days each hospitalization. Have an outpatient surgery, probably going to cost you $250. Have an MRI, it's probably going to cost you $200. And I could go on. And so we have a schedule of copays that the Advantage plan is going to charge you. But what happens is all these copays are going to what we call a max out of pocket. And this is an annual number that resets every January. And right now these range anywhere from about $3,000 to $10,000 max out of pocket. So again, I had no premium, but what's going to happen here is I'm going to pay until I hit the max, and then I'm done, and then so reset every January. Now, one thing that also Advantage plans differ, and that's this: they offer all kinds of perks. And these perks would be a dental allowance and a vision allowance. They also will cover hearing aids, and you pay a copay, but they'll pay the balance. A gym membership, over-the-counter card, just different things that they throw in as a result of the perks that the Advantage plan makes available. So these are the two systems that you have to decide from. And again, I'm going to explain the next slide the differences in these two systems. And there is no right or wrong, better or worse. It really just depends on how you want your insurance to work and exactly what kind of risk that you're comfortable assuming. All right, so I showed you how these two systems vary as far as your ongoing payments, whether it's premiums on a supplemental plan or copays and co-insurance up to the max out of pocket if you take an Advantage plan. But I also want to point out just a couple other differences between these two systems. Number one, over here, if we have a Medigap policy, you can go to any provider that takes Medicare, okay? And the majority of providers do take Medicare, but again, that's a criteria. You got to make sure they take Medicare. Over here, it's not going to be that way. What we're going to have is we're going to have networks, and that's going to be an HMO or a PPO. HMO networks a little bit smaller, a little bit more limitations, restrictions. PPO, a little bit of a broader network and less restrictions. But the point is, over here, you have to make sure your provider takes that. And some take both, some take one or the other, and some take none of these. But the majority here on this side, if they have they take original Medicare, they have to take your Medigap policy. So over here, that's totally a voluntary system that some providers choose to participate in and some not. So that's one big difference, okay? Number two difference would be this, and that is this system, as we saw a minute ago, was based upon premiums. You pretty much got rid of your liability. The G, remember 5 of the 6 gaps they took care of, N 4 of the 6 gaps, but I had a premium. Over here in this system, what's going on is I pay as you go until you hit the max out of pocket for the year. I can assure you, if you were to get sick, get cancer, or some serious health issue, you will spend much more in this system than what you would here. Because here you got rid of the liability, here you took on the liability up to the max out of pocket for the year. The other thing that's different in this system, I'll mention only two, and that's this: pre-authorizations. Okay? Pre-authorizations. And what I mean by that, a pre-authorization is when you need maybe an MRI or a CAT scan or a surgery or skilled nursing stay. In this system here, you have no pre-authorizations whatsoever. That insurance company has no say-so whatsoever in any healthcare service that you're going to get. If your doctor says you need it and Medicare says they'll cover it, end of story, it's going on the schedule. So in this system, no pre-authorizations. In this system right now, what they're saying is about 70 to 72% of the services that you need, yes, you will need a pre-authorization. That means doctor says this is what you need, but that's not the end of the story. That doctor is going to have to submit paperwork to the Advantage company, and someone standing, frankly, in a cubicle is going to make the final decision whether or not you're going to get that knee replacement, hip replacement, MRI, CAT scan. And sometimes they approve them immediately, sometimes they delay them, sometimes they flat deny them. And so you have to be comfortable knowing that when you go in this system, that you're going to have to live with pre-authorization, because that's absolutely the way that they work. And then lastly, the permanency. When you get a Medigap policy, it is written for life. The only way that insurance company can ever cancel that policy is if you don't pay the premium. As long as you pay the premium, you have that plan for the rest of your life. Let's say you live in Denver, Colorado, and you move to Miami, Florida. You take that Medigap policy with you because it's tied to you. It can't be canceled because you relocated. It cannot be canceled because of your age. It cannot be canceled because of your claims. You can be costing that company a boatload of money, but they can't cancel because of that reason. It truly is a lifetime policy. The only thing that you have for maintenance is your drug plan. plan. The drug plan is only written for 1 year at a time. So the beauty of that is you pick your own drug plan and you can change those on an annual basis. If you're taking more meds next year or less meds, you can always change your drug plan because that's once a year. But that Medigap policy is written for life. Not so with Medicare Advantage plans. Those plans are written for 1 calendar year. And frankly, those Advantage plans are not tied to you. This is tied to you. That is tied to the service area where you live. And so if you live in Denver, you move to Miami, Florida, you're not taking that plan with you. You'll have to get a new plan because it's tied to Denver, not to Miami. Now you have to get new doctors, enroll in a different plan. And so these are 1 calendar year at a time. And that's why every year we have this opportunity called AEP and OEP. This happens for 3 months at the first of the year. This is 2 months at the end of the year, where if we need to switch those plans, we can do so. And so doctors come and go, plans change. Sometimes they add a new plan, take a plan away. And so this is very fluid. It's not for life. This over here is the only one of these that's going to be for life. And then lastly, when it comes to drugs, what happens is they embed a prescription drug plan as part of that package. In other words, you didn't pick it. And again, some of them are very good, but you didn't pick it. They picked it. You just have to make sure that it's going to cover your meds well. And again, those are going to have to be changed on an annual basis. And so that's the key differences between these. And again, there's no right or wrong, good or bad. It's just a matter of what you're going to be comfortable with and how you want your insurance.
Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out.
And then lastly, I want to talk about eligibility for these plans and the right time to enroll in the plans. And so keep this in mind. Well, again, let's use the example 7/4/1958 birth date, and someone decides they're going to go on Medicare at 65. So their A date would be 7/1/2023, and their B date is going to be 7/1/2023. All right? And so what happens is, remember that 7-month window we had? That was 3 months before, 3 months after, and the month we turn 65. That's the same way it's going to work if I want to get a Medicare Advantage plan. Okay? You can get that Medicare Advantage plan around your initial enrollment period. There's no underwriting required whatsoever. If that plan's in your service area, you can get that Advantage plan. Now, if I want to decide I want to do one of those Medigap policies, let's say I want to get that G plan. Here's the way it works. So here's the G plan. What the key to this is, I can actually enroll into a Medigap policy 6 months before my Medicare begins. But then also, that extends for another 6 months. And what I can do during this 6-month window, if I didn't buy it 6 months before my B date, I have 6 months after my B date. So in this example, this would be July, August, September, October, November, December. So all the way up until December, I have the right to come in and buy a supplemental plan with no underwriting whatsoever. That means that Medigap policy, that company has to take you. We call this guaranteed issue. There's no underwriting required. They can ask you no health questions. Any pre-existing condition that they have to accept that policy. But keep in mind, in most states, after that 6-month window of your B date has expired, to get one of those Medigap policies, now you're going to have to medically qualify. Now, there's 4 states that are exception to this: New York, Connecticut, Maine, and Massachusetts. But all 46 other states. So if you do not get that Medigap policy either 6 months before or 6 months after that B date, then you may have to medically qualify to get that. And if your health is such where the insurance company says, no, we don't like that pre-existing condition, we don't like the medications you're taking, or we're concerned about rheumatoid arthritis or AFib or spinal stenosis or insulin-dependent diabetic, those kinds of things, they can say, no, we're not going to cover you. So it's a very, very critical time for you to enroll into a Medigap policy. Now, one thing I want to mention about Medicare Advantage plans, remember, there's no underwriting whatsoever. But if you stay on that Advantage plan more than 12 months of your A and B date, what happens after 12 months plus, if you would like to go over here and pick up one of those G plans or an N plan, now you're going to have to go through medical underwriting. Okay, and again, 4 states are exceptions: New York, Connecticut, Maine, and Massachusetts. You can make that decision anytime. But all 46 other states, if you ever want to get off your Advantage plan and get over into that supplemental plan, now they're going to ask you 25 or 30 health questions, check your meds, and they have the right to say, no, we're not going to cover you. And there are a lot of people that take Advantage plans because of the perks, the low cost as far as the premium goes, and then they've been on it 2, 3, 4, 5 years. They want to get off then, and get over here, but their health is such that they cannot get approved, and now they're going to be in the Advantage plan really for the rest of their life. All right, so we don't have ongoing eligibility and ongoing periods just to enroll. So we have to make a decision based upon what we want our insurance to look like, not just because now we're 65 and healthy, but what do we want it to look like when we're 75 or 85, and we want to make sure we have good insurance. You have to make that decision now because you may not be able to change your plan.